Autism is a subject of great debate right now and importance in society. We don't have a great understanding of what causes it, some of the genetics that go into it. So we wanted to bring in an expert, a mind master. We brought in a leading researcher and clinician in the field of autism. Her name is Dr. Danielle Baribeau. Dr. Baribeau works in this field every single day, studies the genetics behind autism, and helps us break down what are some of the core symptoms, the core features, and some tips and tricks, because we all have a hang up socially. We all like to work alone sometimes. We all have hang ups in terms of how we interact with each other. So we can learn from what Dr. Baribeau is teaching us as a mind master in the field of autism. This is an excellent podcast because it gives us the basic information and also gives us some of the new research, what's going on in the future of autism research. I really enjoyed this podcast, and I hope you enjoy it too. Welcome to today's episode of Beyond the Checkbox Mind Masters. I'm Dr. Ryan Todd, a psychiatrist with over a decade of experience. And in this series with leading experts, we will explore the complexities of mental health, breakthrough therapies, and today's hottest topics. This is Beyond the Checkbox Mind Masters. What's your research focus? Like, what is the thing that you are most trying to find out with your research?
Yeah, so my job title is clinician scientist. So I do clinic 1 day a week on average right now, and then 4 days a week is science, so research. And my project breakdown, I would say, is a split between clinical trials and kind of data, health administrative data, and genomic data. And so the big question I'm working most on is amongst kids with neurodevelopmental differences. So we think autism, intellectual disability, rare genetic conditions, kind of what's the best treatment for who. And we're addressing that in a number of different ways. So for some kids, it may be, no medication, certain types of therapy. For some kids, it may be we can actually get at their underlying biology and help them kind of manage different symptoms and traits in a way that improves their life. So it's kind of treatment based in this neurodevelopmental space. Yeah.
It's interesting you say treatment. A lot of what I think people associate something like autism with is that it's fixed, and that, like if we had this conversation 20 years ago, we would say like, oh, you have autism. And then you're like, what are the treatments? Oh, we do some like behavioral stuff. But
Yeah.
you're saying there's treatments and you're trying to find what the best treatments are. What are
Yeah.
the
So
treatments?
that's a really good question. And it's maybe a point of confusion, actually. Much of my work is not focused on actually treating, let's say, autism or the symptoms and traits associated with autism, but more all the stuff that goes with that. So we know if you look at a group of autistic kids, probably about 40% have ADHD. Also, probably 40% also have anxiety that's impairing enough that they might, need to see a specialist about it. Challenging behaviors. Much of my clinical practice is around challenging behavior. So let's say kids who self-injure or who can get physical aggression. I would say much of the kind of interventional work that I'm involved with is kind of managing and treating the co-occurring stuff. There are a few clinical trials where we're trying to get at underlying biology in either rare genetic conditions or in autism, but I would say that that's not the majority, and that's not that common. Actually, we don't have a treatment like a biology or a pill or a molecule that dramatically changes someone's, let's say, life course for things like intellectual disability or the main features of autism. So it's more about treating, let's say, ADHD that goes with that.
Okay. Take us through what is autism? Like, what's
Yeah.
our best understanding as to what's going on in the brain? And then what are the features of it? So people understand like what to look out for in a young person, and then let's move on to like the Asperger's and the spectrum-y stuff, because I think that's also a hot topic right now.
Yeah. So, I mean, autism, the way we've defined and kind of diagnosed autism over the past 20, 30 years has evolved a bit. And we think of it more as a difference, right? So it's not a good thing or a bad thing. It's something different about a child that you can usually identify when they're quite young. Differences in how they relate to other kids and differences in the types of activities and behaviors they spend their time doing. So in a really young child, let's say a 2 or 3-year-old, you may see behaviors like kind of very repetitive play instead of the make-believe play many little kids will engage with, action figures, imagination, that type of thing. Autistic kids may have trouble or have differences in the way they play, more about arranging, organizing, patterns, sequencing, tends to be more kind of repetitive in that nature. Fitting with that, younger autistic people can have preference for things being the same and the preference for predictability. And so, on the one hand, that can be, they don't get bored if you pack the same lunch every day, which is with my kids, or it can lead to challenges, let's say, if the schedule changes. So, you take a different route to school, a different teacher, that can be really hard for an autistic kid, whereas other kids might not mind so much. So one group of symptoms and behaviors or traits are kind of this repetitive play and preference for sameness broadly. Um, with that, little kids can have kind of a lot of sensory differences too. So things like sensitive to sounds and touch and taste and picky eating. The other main cluster of kind of symptoms, traits that we use to diagnose autism relate to social functioning. So these are things in an older kid, it might be, friendships. Are they able to make friends, keep friends, get along with peers? In little kids, it has to do more with the way they communicate socially. So, and when we do an autism assessment on a little kid, we look for, can you direct them with eye contact? Do they communicate in their face and their gestures what they need? Or can they point and check to see if you're pointing to see what they're looking at? Like, can you share attention on a task? And so we know that these early social communication tendencies, if they're either absent or different, this is a sign that a younger child may be kind of on an autism spectrum or along that trajectory. When kids get older, it looks different, right? So a toddler with autism looks different than, let's say, an autistic 8-year-old versus an adolescent. And so the assessments we do kind of have to match people where they're at and what would be our kind of normative development in those different age ranges.
How does it change when somebody's like an adult, they're in the workforce? Because you hear more and more uh, folks who maybe have Asperger's who are in the workforce and they're thriving in the workforce. And then you hear stuff like, oh, Elon Musk has Asperger's or he's on the spectrum. So like the world's richest man literally has something like this. So
Yeah.
what does it look like as an adult? And it sounds also like you can be quite functional with
Yeah.
this and live with this
Yeah.
and thrive with this.
Yeah. So again, I would say our more recent understanding is it's a difference, not necessarily a deficit. I will say, um, you know, children and adults with really high levels of autistic traits can experience a lot of disability from that, right? You can imagine if you had severe autistic traits that you can't have a conversation with someone, that would really impact your functioning the way you described. So you absolutely can have adults who have autistic traits. So let's say needs for things to be the same, really routinized, like routines that they really adhere to. Difficulties with change, but that can be accommodated when you're an adult, right? You set up your routine, you wear your same outfit, you take your same route, and that preference for sameness can actually help people in certain types of work. So if your job, let's say, is coding and you're looking for errors in code, we have some data that suggests an autistic brain is actually better at detecting errors because
Wow.
they look at that inconsistency. In adulthood, so there has been a trend, I'd say, past 5 years maybe related to social media a little bit, where people are more aware of what autism can look like. And some are actually seeking that diagnosis. So I see a lot of teenagers who self-identify and then seek that diagnosis. And so kind of the teens and adults, you might hear descriptions of always having had challenges with fitting in socially and struggling to both, let's say, read social cues from others and understand emotions from others, but also within themselves. So sometimes we'll hear things like, I couldn't tell if someone was laughing at me or joking, or there was this joke told and everyone got it and I didn't get it. So, and what that can look like is interpersonal, either difficulties or more isolation in the workplace. And sometimes kind of understanding what autism can look like can help individuals advocate, right? To say, maybe I don't do the best on the interview, but I'm actually a really good worker, and here's all the skills I bring. So I think that has been this shift of people recognizing those traits, recognizing them in themselves, and using it as a way to understand, some of the difficulties they may be getting into, and advocating to accommodate there.
Is it getting diagnosed more often? And then the question always, always, always in mental health is, well, is it happening more often because of, vaccines? Or is it getting diagnosed more often because we're recognizing it more often? So the fundamental question to start with, is it getting diagnosed more often now?
So if you look on a global level, I recently reviewed a paper where they took data from every country in the world and looked at numbers overall. In the past 30 years, the numbers are not going up. So it's not being diagnosed more in the whole world. But if you look in different regions, yes, in some regions, the numbers are increasing more rapidly, or have increased more rapidly in recent years. So in Canada, for example, I think Saskatchewan has the lowest rate. It's around 0.5%. And New Brunswick has the highest rate, 2.5%. Is that because of something very different in, the water in these places? No, this reflects regional differences in what kind of doctors work there and what kind of diagnosis you need to get to services. So there are many, let's say, funding pathways and clinical programs where you can only get in if you have a autism diagnosis, for example.
Okay. Yeah,
Your
and I would
question about
say on
vaccines?
the water side in
Yeah.
Saskatchewan, I would say the water is not good for your brain there. Just having drank that water for 18 years, it did me no favors.
I also grew up drinking Saskatchewan water. I feel like my brain's okay, but yeah. I was gonna say the vaccine piece though, where I can say, as many things we don't know in science and we say there's no association, the vaccine thing has been ruled out. So many, many people have looked at this in many, many, many data sets and have shown autism is not caused by vaccines. One of the bigger papers was a few years ago now, and they looked at autistic kids, and then they looked at their siblings, and they went to see, okay, so if you've already got an autistic kid in your family, and then you choose to vaccinate or not vaccinate your next kid, does this affect your rate of autism in your next kid? And the truth was, it was no different statistically, but the numbers are actually lower in the vaccinated group. And so all of these kind of associations you may have heard about, 10, 15 years ago were spurious and maybe false. So that's one that we're kind of really confident about.
And why, in your opinion, does this keep coming up? Like a very
Yeah.
prolific politician in the U.S. has very recently, as of last week, brought up that it's increasing in the U.S. because of vaccines. Why does this keep coming up, in your opinion?
Uh, hmm. I think people like to be, I think vaccines are a scary thing to think about. A mystery
Yeah.
substance is going into your body. So understandably, there's discomfort about that. And it is an action that people take to help each other, not necessarily the person that's getting the vaccine, right? Like vaccines work when we all get them. So there's maybe this shift to maybe more individual, decision making. One of the reasons we worried about that association, 30 years ago, 20 years ago, was about 30% of autistic kids will have what's called regression. So they look like they're developing typically, and then around, 1 to 3 years of age, they lose skills that they previously had. We think that this relates to the biology of autism, right? There's different proteins in your brain that build your brain when you're 1, then when you're 2, and then when you're 3. And so it's actually it's a very common thing that happens in autism. But for families who vaccinate their one, like if you think about the vaccine schedule for a kid, you're getting shots every couple months for much of their early childhood. And so when you look back, what was different around, that 3-month window, what did I do? There's kind of we would call like a recall bias that we tie those things together. Now, I will say there are some very, very rare, let's say we call them metabolic conditions. So rare genetic conditions where when your metabolism is stressed, so that can be a fever, that can be an illness, can be certain things in your diet, and it can be vaccines. And this affects how your metabolism works. And those kids very, very, very rarely can get behavioral symptoms and regression. So it's not that the vaccine caused them to have autism, but that they had an underlying condition that when their immune system's stressed or their body's stressed, it gives additional symptoms. But so there have been a few court cases on those ones, but that's the vast majority. No, that's not a thing.
What do parents do when there's a diagnosis of autism? What are some of the tools? What are some of the ways to help? I have heard that early diagnosis is important so that does that change the trajectory in your opinion and what you've seen in the science if you get diagnosed early and get supports in place?
Yeah, so we have some data showing for some of the, let's say, outcomes related to independence. So let's say communication skills, some self-help skills, and some thinking and learning skills for children with more, let's say, severe forms of autism, identifying them early and matching them to therapies and education that fits that can make a big difference in their skills and abilities when they're older. So if you think of a little child who's maybe 2 or 3 with an autism diagnosis who, is not at all interested in learning, is very fixated on, let's say repetitive movement, sensory play, and isn't motivated by, praise from the adults in their life. That kid's going to need a very different educational approach than the typical kid where you say good job and you show them their letters and their numbers and you sing ABCs. And so we have good data to show the earlier you kind of connect kids to this specialized type of education, the better. Long time ago, we used to push for very high intensity, something called IBI, intensive behavioral intervention, where kids would spend, let's say, 40 hours a week in one-to-one therapy, teaching them all of the foundations of, let's say, eye contact and verbal responses. That's no longer what's recommended. We now, what kind of guidelines would suggest what's something called, well, I won't get into it really, but more naturalistic interventions where you help parents, where the therapist teaches parents to engage with the child in a way that really gets that buy-in from the kid. And so some of the skills are like, if your child's not listening or paying attention to you, make sure you really get down on their level and have them present and work on shared enjoyment with that kid in a way that might come more naturally for other children. So we call these kind of naturalistic interventions, and that's a support, kind of the guideline now for autistic kids.
You're helping the parents help the kids. And it sounds like it's a matter of, in large part, motivation to teach skills. Like in this case, social skills, and then also basic like math and English and literature and like all the stuff you learn in school skills.
Yeah, I will say though that there's a growing kind of group of children, youth, and adults where the autistic traits are mild enough, or not as impairing in the degree that we want to change these individuals, but we want to recognize and accommodate. And so I'd say for teens who are, different and have different interests, where I'd say the focus is less on, teaching them how to socialize and more on finding ways to socialize that are comfortable and inclusive to them. So where, some 15-year-olds may be dating and going to parties, maybe we're okay with the fact that a club around a special interest is their main form of socialization, and that's okay. So we're not looking to change who they are or how they interact, but understand that differences are okay too.
Does it stand to reason that that's the same in the workplace? Like I'm seeing a much more about neurodiversity in the
Yeah.
workplace, and I'm seeing some really like kind of really good thought leadership and folks in this space, especially in human resources, who are looking to not just accommodate, but find different ways of working with folks who are neurodiverse so they
Yeah.
thrive in that workplace. Are you seeing that as well? And because it sounds like there's a movement to not change that person, but give that person skills in a naturalistic environment and try and
Yeah.
change the environment so
Yeah.
that they can thrive in.
Yeah, exactly. So if you think about this neurodiversity movement, which you may read about or hear about online, it's the idea that much of the disability that comes from these conditions is not the condition itself, but it's a society that's not accepting or open or inclusive. And so things like, I'm trying to think of good examples, somebody who's very sensitive to sounds. A mainstream high school may be a really uncomfortable place to be because it's loud. There's bells going off, there's fire alarms, everybody's talking. And so it's not that that person can't do high school or can't do the curriculum, but the environment is not inclusive to their unique needs. And so one option is we send them to a specialized school where it's, quiet, fine, or we work to make our education systems more inclusive to kind of these diverse needs. The same thing in the workplace. To your point, I think, for some people, autism or these differences can also be a superpower, right? Where, if you have a really intense interest in something or really good pattern recognition, you may perform better than some other people on a specific task, provided you can have the support you need to do that in the right way.
I want to get into like the spectrum idea around Asperger's and autism, and like to tell us that, like, talk about that. Is it that everyone is sort of on this spectrum, and on the extremes we have folks who have a diagnosis of autism, and on the other extreme we have folks who are like highly emotionally intelligent, can adapt to everything, and is it all on a spectrum? And then if so, how do you know when somebody has autism versus somebody is just socially awkward?
Yeah. So if you look, it's a good question, but I would say is my Tuesday challenge when I do clinic. Kind of where do we draw the line? And
Yeah.
at what point do we consider this human diversity or personality? Like some people, that's just how they are. And it's not a disability. It's not a disorder. It's just a difference. So I would say if you look at the diagnostic criteria, it is focused around impairment and kind of persistent difficulties. And so for me, I use the cutoff. Does this person need some official accommodation and some official support, let's say, for transitioning to the workplace or in school? So if we feel this person needs a little more than the average person to thrive or to be okay, um, and those traits themselves, let's say the repetitive difficulties with change, sensory stuff, or the social challenges are big enough that they're getting in the way for this person or distressing for the person, that's when maybe we think about an autism diagnosis. You talk to anybody, like you go through the DSM, this as a psychiatrist, Ryan, like you pick any condition, all of us have a little bit of it, right? Like,
Yeah.
tend to be restless with boring cognitive tasks or tend to be awkward in new sort of social situations. So, I'm not in the business of pathologizing all of our human experiences, but there are some people where with a bit of accommodation, a bit of attention to the environment, they can thrive. And so I think that that's the difference. I'll also say for some children and youth, and I guess adults too, mm, autism can be very disabling, right? Like you can have people who have average thinking and learning skills, but due to their autism symptoms and traits, they may not be able to work. They may not be able to live independently. And so I think when we talk about spectrum, we mean both, the types of differences that people have. There's a wide range. Not everybody looks the same, but also that for some people, this can be a highly disabling condition. And for some people, it can be, a difference that with some accommodation doesn't impact their work life that much, right? So this idea that it's a wide group of individuals.
Do people with autism experience the world differently? I know that's a tough thing to get at. Like, but is there a different experience in empathy or theory of mind or um like definitely social awareness? That's one of the primary diagnostic criteria. But do they experience uh interactions differently than someone who is neurotypical would experience them?
Yeah, I think there's an adage, and I don't remember where I've heard it. Like, one person with autism, or one autistic person, one autistic person. So everybody's experience is a little bit different. And when you look at the criteria, it can be both over and under of different things. So for one kid where, let's say they're really sensory sensitive, sounds and lights and taste can be experienced as painful. I saw a
Oh
kid
wow.
recently who described the shower as painful. Showering hurt him, and he needed to like rub sandpaper on his body to compete with the pain of the shower, that type of thing. There are equally kids who don't seem to notice pain and might, pull out their fingernails and not notice. So I would say one kid's experience is not the same as the other. For the social piece, like some people, it may be an unawareness about, all those subtle social interactions and signs that we send each other, the subtleties of how someone's eye contact shifts when they're, not as pleased or they're, interested, that type of thing. So some of it may be missing that. For some people, it may be misinterpreting that. So assuming, a shift in facial expression is something negative, or attributing it to, something prior in the conversation. So kind of sometimes we talk about integrating all that stuff, and that it's the integration that's hard for some autistic people. If you think about when you're having a conversation with a loved one, let's say, you're both watching their face, you're trying to think about their perspective, you're trying to come up with what you're saying in response to their perspective. You're moving your hands, you're looking around the room, you're changing your face. Like there are a lot of different things going on. And so for some autistic people, it's that like so much input in the social world at the same time that's challenging, not every individual one on its own.
That's super interesting.
Mhm.
One of my theories, and this is probably wild and untrue, is that at least some people with a degree of maybe Asperger's, is that still a relevant term, by the way? Or is that
We
like
don't use it.
pejorative? We don't use it?
It's not pejorative. No, it's fallen out of favor related to World War II history a little bit, and it's no longer in.
So Dr. Asperger was like, and ended up being a horrible person?
There may have been some ties to different things. Yeah. So we don't tend to use that term anymore. I would say as of DSM-5, like 2010-ish, it's all just autism spectrum disorder. But I will say language in the autism space is a really tricky thing. So I get nervous during these types of interviews actually because I can unintentionally misspeak and someone will be offended. I'll
Interesting.
give you some
Yeah.
I'll give you some examples. Like, there are many members of the autistic community who prefer we say you're an autistic person, not a person with autism. So we're
Yeah.
moving towards this like identity first language. Not everybody feels that way, but that seems to be the most common preference. And that's different from when we trained, right? Where we would say, you're a person with schizophrenia, you're not a schizophrenic.
Yeah.
This kind of reflects the sense that for some people, it's not a negative part of them. It's who they are, and it's something. I'm a woman. I'm not a person with womanness. Like that doesn't. It's part of my identity. So,
Yeah.
I would say language is a really sensitive area when you're in kind of the neurodevelopmental world. Uh,
Interesting. Well, if it's any consolation, I'll be the first one to get canceled from this interview, and I think it'll
I
be
don't
good
have a
still.
podcast, so
Yeah.
thankfully. Yeah.
Um, did the question I had was around empathy, because
Yeah.
the one wild theory I have,
Yeah.
if nothing gets us canceled, it'll be this theory, that entrepreneurs who are on the autism spectrum sometimes can do really well because they don't either pick up those gentle cues and they just keep going on the mission. Like in my experience, one of the most difficult parts about entrepreneurship is you have you end up interacting with so many different staff who have all different motivations, and they want to do
Yeah.
this and they want to get paid this much and they don't want to do that piece of work, and
Yeah.
all these inputs from hundreds of humans, investors, employees,
Yeah.
customers, and you have to consider all those, and it's actually impossible to consider them all. So somebody like maybe Elon Musk in the example the reference earlier just doesn't even pick up on them, let alone care about those cues. So he would just go forward with his
Yeah.
mission, regardless of the human suffering and toil that happens. So that's the theory, that it can be actually beneficial. But that makes it sound like some people with autism just don't have empathy. And I don't think that's true. They just maybe don't pick up on those signals as much as other people.
Yeah, I would say back to this, let's say, one person, one autistic person, one autistic person, that I think each individual's experience is different. On average, much of the earlier data showed that, let's say, autistic kids, for example, had challenges with theory of mind. So, and that's a little bit this empathy piece. So not necessarily, feeling other people's feelings, but understanding other people's perspective. So there are famous experiments where, if there's multiple characters and one knows something, but the other one doesn't know something, it's hard for autistic kids to figure that out. How can one person know something that another person doesn't know? So this idea of separating your perspectives from other perspectives is a common area of difficulty. To your point, and I'm not going to speak about Elon Musk, I don't know his situation, but this balance of not picking up on or not being distracted by all of those social emotional cues for someone with a certain, determination, that may be a helpful thing in certain settings. Overall, though, to have a diagnosis of autism, we would need evidence of, disability or impairment. And so this is where I get into struggles sometimes with people who are seeking an autism diagnosis, yet have no, let's say, difficulties with their relationships or their workplace. We do have to respect the how difficult it can be for some people. And so, this blurry line, where do you cut it? I think when you need additional support and you're having challenges because of these traits. So, I don't know, if someone's work situation is going really well because of that, determination, I wonder about their home life as well. Are they getting into conflicts with their loved ones? Are they able to have social relationships at all outside of work? Kind of what does that look like? It's thinking kind of holistically about that person's, social world.
And if you have dysfunction in one of those areas, like you could be an incredible entrepreneur, like recently Bill Gates has said, I think he was on the autism spectrum, and as is Elon Musk. So literally the world's richest people.
Yeah.
And if they are having dysfunction at home, could you still say that they are on the autism spectrum?
That's a good question. So to do an autism assessment, I spend probably 3 hours with someone,
Okay.
maybe more. So I think there's no single question or test where I'm like, aha, there, for kind of these borderline, like on the edge cases. I would say if you are the boss of everything and you don't seem to be responsive to your employees' social emotional needs, and you don't perceive challenges in that setting, but in your home life, there's constant conflict and, challenges maintaining relationships, that could be, something we take into consideration. Usually for autism, it's not in a single environment. It's not in a single year of your life. Like it is, the degree to which it gets in the way for you waxes and wanes. Like it depends on the environment, but it's not something you'd suddenly kind of wake up with when you're, 15 or 55. It's considered developmental. So something where those differences were present all along, and whether or not they're causing trouble for you, depends on the environment you're in.
Yeah. Okay. That makes a ton of sense.
Yeah. I
Couple
know
of
you're
things.
trying to trick me into diagnosing
No,
celebrities, and I'm not going to do
it's
it.
easier for me to
Yeah.
diagnose someone off reading an article on Psychology
Yeah.
Today than sitting down
Yeah.
with them for 3 hours. So my role is a little easier. Um,
Yeah.
could you speak to social skills and like, are those
Yeah.
trainable? Can you train people to be
Yeah.
more social, more likable, more in tune with their social environment?
Yeah, so absolutely. And I wouldn't view it as training. Like I'm not in the business of training somebody to conform, but if it's a priority for someone who says, and this was actually a study I did last year with a student where we looked at autistic kids who became depressed in adolescence. Who got depressed? It wasn't the kids who had no friends. It wasn't the kids who were bullied. It was the kids who were lonely. And
Mm.
so, what stood out to me is it's not necessarily, how much trouble you have with social skills. It's whether your social needs and you wish you had friends and you can't get there. Like there's a mismatch between skills and abilities and goals. So absolutely you can work on that. There's some, there's group programs where they walk you through, how do you set up an outing with a friend? Let's talk through all the steps of phone calls,
Oh
making a
yeah.
plan. Um, Working on emotion recognition. For some autistic teens, I find um, the struggle is even identifying their own emotions. There's bad and there's not bad. And kind of how do we differentiate angry, sad, embarrassed, all of the other kind of subtleties there. And it can be harder for them to pick up on, but with practice and familiarity and kind of knowing your own cues, that definitely can grow. It's the same as with us. Like if you think coming out of COVID, how awkward people felt going to social gatherings. I remember the first wedding I went to when COVID restrictions lifted, and I was thinking like, I don't know how to be in a crowd, and I feel so out of place. And then with practice, it comes back. It comes back. So to some extent, for sure, it's something you can work on like any skill.
Super interesting. What are you most excited about in this field coming? Like, what's the coolest
Yeah.
research, the best thing you've read recently? What excites you about this field in the next 10 years?
Okay. I'm going to tell you, it gets really technical. So hopefully you can follow it along. If you think
You know my
of,
cognitive abilities from
so,
knowing me, so
okay,
you might have to pare it down to those abilities, knowing
okay, I'm
knowing
going
that
to
you
try.
know my
You're,
limitations.
you're very smart. So if you took a group of kids with, let's say, intellectual disability. So intellectual disability would be thinking and learning skills that are much behind their same age peers. Um, Growing up, they may not be able to work independently, that type of thing. So intellectual disability. Um, you know, 50 years ago, we said we have no idea what caused it. 20 years ago, we said we have no idea what caused it. Sometimes you would hear rumors like he dropped him on his head, the mom had a sip of wine, like what caused this intellectual disability. We now know through genetics about half of kids with intellectual disability have a genetic change that explains differences in how their brain grew and developed. And so it's not a single one genetic change, there's thousands, right? So, and these are not ones, genetic doesn't mean, inherited from the parent. Oftentimes they're new. So when the sperm meets the egg, all the DNA are kind of crisscrossing over. And there's one little difference that happens and that leads to changes in how the brain develops. And so what's exciting about that for me is now we have biology that we can start to kind of understand and group and cluster and make sense of. So some of my work is looking at matching kids with subtypes of these genetic changes to the best treatment for them, whether it be for anxiety or even development. And with that, we're starting to get into genetic technologies where, so for example, Angelman syndrome is a genetic syndrome associated with autism and intellectual disability. And we now understand the biology of it, and we're making genetic therapies that directly target that biology. And so maybe in the next 5 to 10 years, if you have a child who's very delayed in their development, not walking, not talking on time, we may actually have a biological treatment for that child to to promote and kind of increase that rate of development. We're not there yet, but lots of people are working on it. It's proving really tricky, but I find it very, very exciting. Whereas much of psychiatry, as you know, has been kind of pattern recognition, gestalt matching of people based on symptoms. This is actually getting at underlying causes.
Yeah, that is incredible. And I wonder if that opens the way or the road for other psychiatric conditions to be mapped in similar ways.
Yeah, a
Like
little bit.
depression, anxiety, ADHD, schizophrenia, bipolar disorder, substance use, like everything is pattern recognition for the most part. And I
Yeah.
wonder if this sets forth a new field where we can actually map these genetic changes.
Yeah, it's a good hope. I would say the area of genetics is infinitely more complicated than I think any of us understand right now. When it comes to um, genetic causes of things, we have these rare, big differences that have a huge impact on the brain. Often a kid who's very different from both his parents, it would be a new genetic change. So something like intellectual disability or severe autism in a kid whose parents are non-autistic. So that is kind of this rare high impact space. But you're right. If you look at all, mental health conditions, we're starting to find ways of measuring our genomes and measuring, let's say, lots of low impact genes and how they combine. So you may have, let's say a mom who's very anxious and a dad who's very inattentive and hyperactive. What combination of little genes wind up in their kid, you know, for most of history was luck. And you'd say, oh, maybe you got that from your dad. Now we're starting to get to the point that we can say, oh, you've got a high polygenic score for XYZ that probably came from blah, blah, blah. So we're starting to understand that biology a little bit more. It's nowhere near having clinical usefulness yet for most of mental health. This is kind of learning and trying to understand, but I'm hopeful, going forward for some people, it will make a big difference.
It's exciting. If
Yeah.
one day you could tell me how many kids I need to have before I get a professional athlete, that'd probably be the most like what combination of things need to happen there, temperature
Yeah.
wise, like where I have to
Yeah.
be in the world to produce a NHL hockey player. That would be really helpful.
Do you want to know how you get an NHL hockey player? You marry an NHL hockey player. So,
No, this
uh,
is really cool. I think we learned a lot. There's some really there's some core basics here, but this
yeah,
field is so expansive and it's really
yeah,
exciting that you're on the forefront of it. I mean, obviously I saw little hints of that when we were training together, how you were figuring things out and also getting all these research awards and doing rounds and it's exciting, but what's super exciting to me is how on the forefront of this field you are and
yeah. It's super
following your
cool.
career is really cool. So thanks for
Yeah.
spending a little time with us to teach us about autism.
Yeah. Thank you, Ryan. So nice to talk to you. Lovely to join your podcast.